The other main part of the ACA was Medicaid expansion. And under Medicaid expansion, the federal government reimbursed the vast majority of the cost for this population of working age, able-bodied adults. To date, 40 states have adopted Medicaid expansion. Paragon was asked by Florida health officials last year to assess what would happen if the state of Florida expanded Medicaid. And we wrote a report on the subject, and I want to go through the highlights of that with you. The actuarial firm Milliman conducted the estimates of what would happen if Florida expanded, and we also carefully reviewed the experience of other states that adopted expansion. And we expect a similar situation would occur in Texas. As would happen in Florida. If Texas were to expand Medicaid, the state's Medicaid enrollment would increase by more than 3 million recipients. 2/3 of them would replace private coverage with Medicaid, a phenomenon called crowd out. Nearly 2 million of them currently have this highly subsidized exchange plan. They would replace these plans where the state bears no cost with Medicaid, where the state share would be at 10% of the cost. Medicaid enrollment would increase from about 13% of the state population to about 23%. We often think of welfare programs in terms of the number of workers per welfare recipient. If Texas expands, the numbers of workers per Medicaid recipient would decline from 3.4 workers to 2.0 workers. The fiscal cost to Texas would be nearly $2 billion a year over the next decade. And one major risk to Texas, as well as states that have already expanded Medicaid, is if the federal government lowers the 90% federal rate for the expansion population, which I think is something that is likely to be considered given the dire fiscal condition, the $2 trillion annual budget deficits, the fact that net interest payments on the federal debt now exceed both Medicare and national defense. President Obama actually had a proposal in his 2012 budget to reduce the 90% match rate, and the 90% match rate was reduced in legislation that passed the House of Representatives in 2017. If that 90% match rate is lowered to Texas's traditional match rate, Texans would be on the hook for about $7 billion additionally each year in costs. We also know a lot about the effects from the states that have expanded Medicaid. Enrollment, first, I'm going to, in my testimony, I list 12. I'm going to go through just a few of them. The first is that enrollment and spending were much higher than states expected, in part because many ineligible people were enrolled, and many people were enrolled without proper eligibility determinations. In some breaking news, a new study that's been reported on today estimates that 30% of all Medicaid enrollees nationally were not aware that they were enrolled in the program in 2022. Second, expansion led to a surge of waste, fraud, and abuse. Federal improper payments in Medicaid increased from $14 billion a year in 2013 prior to expansion to an estimated $99 billion in 2021. Third, expansion led to a reallocation of services away from existing Medicaid enrollees. In expansion states, services were diverted from low-income children and people with disabilities to the expansion population. Fourth, expansion reduced access of care for traditional Medicaid recipients. Many providers refused to treat Medicaid patients because of low payment rates. Medicaid patients were 1.6 times less likely to obtain a primary care appointment and 3.3 times less likely to obtain a specialty care appointment than people with private insurance. In expansion states, we know that Medicaid patients suffered longer wait times, reduced appointment availability, and increased wait times for ambulances. Because Medicaid recipients have a difficult time securing appointments, one of the clearest findings from expansion is that emergency room use soared for non-emergent services. Fifth, Medicaid enrollment does not produce clear health benefits. The best study that we have on this was actually from the state of Oregon a little over a decade ago. They had a limited number of spots for their Medicaid program. and they determined eligibility through a lottery. People that won the lottery got enrolled in Medicaid. People that didn't win the lottery didn't get enrolled. And it allowed researchers to compare the health effects of people that gained Medicaid and people that didn't. And it turned out there was no health benefit from people gaining Medicaid. The researchers looked at cholesterol, blood pressure, and blood sugar. Since Medicaid expansion leads to a surge in demand for services, the resulting reallocation of resources reduces access to care for many other people in the state, particularly existing Medicaid recipients. I wrote a paper, research paper for the Texas Public Policy Foundation in 2020, looking at the health effects of Medicaid expansion, and found that mortality trends worsened in states that expanded Medicaid from 2013 to 2017 relative to non-expansion states. My thorough review of the academic literature on the health effects of Medicaid expansion led me to three reasons for why large Medicaid expansions disappoint. The first is that people that don't have health insurance still get health care. In fact, uninsured people receive about 80% as much health care as similarly insured people. The second is this large crowd out of private coverage. If the private coverage is superior and offers better access to care, crowding out private coverage for Medicaid is going to have negative health effects. And finally, the indirect effects on others from longer wait times for care.